Yes, friends. So, welcome back to our subject discussion on cardiology. Today, in today's video, we will discuss in brief about a very important disease. Already, we have discussed that is hypertension and the different drugs or the opportunities. See, today, antihypertensive is one of the very big market world over because of change in lifestyle and the complications we have discussed due to related to cardiovascular system. Hypertension has become a almost like a killer, a silent killer. And today after the death, people are aware that he died because he was hypertensive. Now now question is, this blood pressure in normal, as a layman, people they call as blood pressure. Is it good or bad? Actually, blood pressure is good. Because of blood pressure, heart is able to send everything from one place to another, and because of pressure through capillaries, the capillaries are single cellular structure, single cell, and there is an intercellular space. So between the intercellular space, everything is given, and the things are taken. Metabolites, waste products are collected, nutrient, everything is given. So due to blood pressure, this is possible. If there is no blood pressure, we cannot survive. So blood pressure is good. Otherwise also, some pressure is always good everywhere. If there is no pressure, then things go out of the way. So if blood pressure is normal, we call as normotensive. Normotensive, it is good. But when it is more, we call this as hypertension. When it is less, then we call this as hypotension. So both are dangerous. Both are dangerous. I will say hypertension is more dangerous because many times there are no symptoms. But hypotension, there are immediate symptoms. For example, you may feel giddiness, vertigo, something like blackling, and you feel not comfortable. And even if there is more hypotension, you will fall because your heart is not able to pump blood. Left ventricle is failing in its job of putting blood, so it is failing, so you will fall. There are so many hypotensive, they fall and they can be damaged, injuries and all that. So hypotension is good because you get signal, okay? But hypertension is definitely something which is a silent killer, gentlemen. So for hypertension, there are limits, and the different countries, maybe there is some controversy, means what is the ideal limit or this, but what we are telling is these are the limits as per the classification given by cardiac society. So for diastolic and systolic, these are the limits. So for systolic blood pressure, the normal limit is 100 to 140. These are normal. So it depends on the age, because as with the age, arteries will be hardened. So the internal resistance will be more, pressure will be increasing. So depending on the age, for example, somebody at the age of, I am 65 now. So for me 140 is very normal for me. Okay. So this is the normal blood pressure limit for normal, for 100 to 140 millimeter mercury for systolic is normal. And for diastolic, 70 to 90 is normal. Now they are called as labile hypertensive. Labile means, they are at the borderline. So 141 to 160 are labile, and 91 to 95 also for diastolic are labile. So labile means these people, if they make changes in their body, lifestyle, they make changes like cholesterol, exercise, yoga, meditation, we were discussing na autonomic nervous system. So when you are worry, you transmit worry to the God, and God takes the worry. You relax. So because of meditation and change in lifestyle, exercise, not strenuous gym, but normal exercise. These are, so there is a possibility of reversing these being normal labile. So drug therapy may not be required. It depends on the doctor's discretion. But above 160, these are the definite hypertensive. Definite, huh? They need active drug. Definite. If it is systolic more than 160 and diastolic more than 95, these are definite hypertensive and they need active drug therapy, friends. Okay? So, these are the limits for blood pressure, hypertension, and now coming to the treatment part of hypertension, they need very active drug. Whatever antihypertensive doctors are prescribing. Now the etiology of hypertension. Why? There are multiple. It is a multi-etiological disease. There are so many factors. But one very important is the sympathetic stimulation. More sympathetic adrenaline release. Always you are active. So because of that, when adrenaline is released, heart force has to increase, pressure has to increase. So adrenaline will dilate coronary artery, because that time coronary perfusion supplies has to be more, so it will dilate. Okay, but peripheral tissues, arteriole will constrict, because by constricting pressure will increase. Okay, so that time your or when you are running, then physiology of blood will change. So the blood may become more acidic. So when blood is more acidic due to accumulation of more carbon dioxide, because your respiration is more, you are running. So that time in blood, the pH of blood will change, and there are receptors in your body which are watching pH of your blood, and there is also watching your pressure. So there are baroreceptors. Okay, baro means pressure, like barometer. There are baroreceptors. Now these baroreceptors are watching your your blood pressure. If you are always agitated, always adrenaline is coming, and you are always active, then the baroreceptor increases your level of your pressure. And the time can when it puts permanently on that. But okay, for you 150 is the normal. For systolic 150 millimeter mercury, keep it. And now even if you relax, the pressure may not come down. Okay, so overactivity of sympathetic nervous system is one very reason. So the drugs work at different level. So there are drugs working at sympathetic level. Okay, and there are drugs working at peripheral level. Peripheral, these are dilators basically. They dilate the arterioles at the peripheral, so blood pressure comes down. And there are also drugs which relaxes the muscles, cardiac muscles. So there are calcium channel blockers. So calcium entry into the cell increases the activity. So when calcium enters the myocardium and the other tissues, they contract and increase their blood pressure. So calcium channel blockers are very widely used drugs. Okay. Then beta blockers are very important, and also angiotensin receptor blockers. We will not go into that, your company will tell you, but from liver and from kidney there are substances, renin and angiotensin, they come and then there is an enzyme. So there is that enzyme, when it comes angiotensin, then that increases blood pressure. So there are drugs called as angiotensin receptors blockers. Okay, or angiotensin AC inhibitors. Angiotensin converting enzyme into, these are older drugs because they don't allow conversion of angiotensin. They block the enzyme. But in that process, there are something minus also in that. They cause some side effect. So there are AC inhibitors, angiotensin converting enzyme inhibitors like Olpril, lisinopril and perindopril and like that. These are the drugs. Okay. And now after advancement, the other drugs have come, angiotensin receptor. They say forget enzyme. Let us block the receptor for angiotensin. So blood pressure will not increase. So there are all sartans are ARB, sartans. Any drug ending with sartan, like sartan, losartan, candesartan, valsartan, all sartans, they are angiotensin receptor blockers. And now kidney is very important, the place which is also regulating your blood pressure. So they give diuretics with excrete. Actually, excessive sodium is also a very culprit in that. So doctor will reduce sodium intake and also excrete sodium. So all diuretic basically, they excrete sodium. So there are saliuretics. Selenium means sodium. So there are saliuretics. They excrete sodium. When sodium doesn't go as a powder, it goes with water. So water goes, blood pressure comes down. So hydrochlorothiazide and like there are potassium sparing diuretics also, which doesn't allow potassium to go, because these diuretics, if there is a loss of potassium, then there are adverse effects. So these are different drugs coming. And then peripheral, the peripheral vasodilators, prazosin, all these drugs are used by doctors. So your company will tell you what drug they are marketing, what drug you should promote. But remember, every drug has its own advantage on disadvantage. Okay. Now AC inhibitor have advantage. Okay. Because they have something beneficial role on renal function. ARB don't have, but they have another, like dry cough is a problem with AC inhibitor, which is not seen with angiotensin receptor blocker. So every drug has its own plus minus. It depends what your company is promoting. So your product manager will train you. I don't think this this video purpose is to discuss that. Okay. But one thing before we close the video, you remember that this hypertension is actually, the word is not hypertension. The correct word will be essential hypertension. Essential. So what is essential hyper? Why? Is it essential? No. The reason is here, essentially the reason of hypertension is hypertension. There is no other underlying cause. So what is essential hypertension? When hypertension is essentially due to hypertension itself. So remember, that drug therapy, all your 99.99% drugs sold are for essential hypertension. Hypertension not alone, essential hypertension. Because there is another hypertension you should know, that is called as non-essential hypertension. Non-essential. So what is non-essential hypertension? Here, the reason of hypertension is not hypertension itself, but some other underlying cause or disease. So due to that, there is a hypertension. The advantage here, you can permanently cure this non-essential hypertension, because you remove that root cause. Now suppose there is a kidney stone. Now due to stone in the kidney, lithiasis, nephrolithiasis, there is increased blood pressure. So remove that, treat the kidney, blood pressure will be permanently treated. Now during pregnancy also, there is a hypertension during pregnancy. So drug treatment is not required unless until there is hypertensive crisis. As pregnancy will be over, the child will come out, blood pressure also will be normal. So this is what is non-essential hypertension. Here, 100% treatment is possible with that, removing that cause. But in essential hypertension, you need drug therapy long, maybe lifelong. Cardiologist knows, we are not cardiologists. we are medical representative. So as long as doctor gives drug, we are happy. Happy because the patient life is saved and he will not die because of hypertensive complications. So hypertension also causes complications. We will discuss if time will permit in another video. So friends, this is brief. So we have discussed the organs of cardiovascular, we have discussed the heart, we have discussed circulation, we have discussed angina pectoris, and we have also discussed now essential hypertension and that. So cardiology, almost we are coming, almost closing this subject. Whatever little remaining, I will discuss. One day we will discuss about diabetes also and complications. Okay. Now these videos are helpful for particularly for those who are non-biology, non-pharmacy people. So you have some idea about it. That is why we started this series. So enjoy the video. So thank you very much. Have a good time.